Good morning, everybody, and welcome to another podcast from Ashall Technology. Today, we're very fortunate because we're talking to Liz Ashall Payne from ORCHA. Hello, Liz.
Hi, thank you so much for inviting me to speak with you.
No, it's a pleasure to see you, Liz, and I'm delighted to have you here. Liz, I was wondering if I could ask you to tell the audience a bit about yourself and how you started from a speech therapist to running what is probably one of the largest digital health resources for rating apps in the world today.
Yeah, of course. So I quite often, when people say, where did you start? I quite often say I started my passion and mission when I was 15. And when you get asked at school, what is it you want to be? And of course, none of us know what we want to be, but I knew what I wanted to do. And what I wanted to do was help people. And so that naturally took me into thinking about health and healthcare roles. And I thought, oh, I could be a doctor or a nurse, but I'm really squeamish. And then I saw the job of allied health professionals and therapists and found the work of speech and language therapy. And I thought, oh, that will work for me, because my school reports always said could do better if talked less. So I pinned my hopes on that and I went off to university. And bearing in mind, when I qualified, this was around about 24, 25 years ago. So we didn't have laptops, computers, smartphone devices. But on day one, I was so excited because I thought, well, today I'm going to start to help people. And I was so excited. But at the end of the first day, I felt really frustrated because I'd only seen 6 patients. And as a clinician, you can only see 1 patient at a time. And so I got really frustrated because I knew about the waiting lists. I knew that there were, thousands of people who needed access to healthcare. And that really took me in a different direction almost immediately. And I got interested in pathway redesign and thinking about how we can do things differently so that we can help more patients have access to healthcare. So I got interested in lean methodology, Six Sigma, pathway redesign. And then you fast forward probably 10 years and you start to see the rise of technology and then eventually the smartphone. And with the smartphone came health apps. And I thought, well, all we need to do is put together digital health into the hands of people so that more people can have access to healthcare whenever they want. But of course, it's not that simple. And I then got obsessed with the barriers. And it was that really drove me to get interested in technology and digital health.
So Liz, tell me about the days you spent in the NHS. You've spent 6 years in the NHS, is that right?
No, I spent nearly 20 years working in the NHS. So I started my life initially as a clinician, and then I moved into specialising in complex paediatric care. I then moved into change management and ended up on the board leading quality improvement, as it was called back then. And then I worked regionally supporting other system leaders to support the adoption of change management, including technology to benefit people and patients. And then I took a national role leading on digital health, which was very innovative. But the reason I was given that role was because I knew about change and sustained change. And then that role was very much about adopting digital innovation, but not just from a patient and a population health benefit, but also from an economic development perspective.
Okay, I understand. That's very interesting. It's good to know that you come from a clinical background and also a management role, a national management role in health apps. So how did you start ORCHA, and exactly what does ORCHA do?
Yeah, of course. So when I was doing that national role, looking at digital health technologies, my job then was to get the NHS to adopt amazing technologies. And I felt that I'd gone backwards because I was then back to knowing about amazing technologies and having to talk to individual organisations or individuals about technologies that I knew about. And I thought that surely there must be a systemic approach to deploying and activating people to use trusted technologies. And I got obsessed with thinking, well, how do we do this in other parts of healthcare? And if you look at the way in which we distribute drugs globally, millions of people are prescribed a safe, effective drug every single day. And in order for that to happen, there's a very clear system, which is about licensing, building trust. There's then an education, which is about training would-be prescribers in drugs. And we then have access to drug formularies and a prescription infrastructure, which is about tracking what drugs have gone where, to whom, and providing reimbursement. And I thought that's what we need for digital health. So in the world of digital health, if you've got 365,000 technologies, how do you get the right safe technologies to people? Well, you need a similar process. And that was really the starting of my thoughts for the creation of ORCHA. So how do we license and test and evaluate technologies? How do we then get would-be recommenders of technologies to embrace these tools and embed them into pathways? How do we provide clinicians and healthcare professionals with access to a repository or a formulary of digital health, and then provide a prescription infrastructure? And that's what we've been building. So that was 8 years ago. It was a very serendipitous conversation that got me started. So I was basically obsessed with the problem. And I had a conversation with somebody who said, I think somebody would be interested in giving you some money to get this started. And they did. I was very fortunate. And so that was 8 years ago. And what we've built is the ability to assess and evaluate technologies repeatedly and proportionately, and then connect that information through distribution channels. And that starts with education, and then digital health formularies and prescription infrastructure.
Okay, so I know from my understanding of the organisation that you've also become part of it. You've also participated with the Health and Social Care Select Committees. You work with, I know, Boehringer Ingelheim. You've worked with GGZ in the Netherlands and a number of other organisations. Can you tell me something about that?
Yeah, of course. And I think what we've started to see is a real revolution in this space. And that's come because we now have an opportunity with all these technologies coming to market, but we also have a healthcare crisis. And I think what people are seeing is that there is a real opportunity and need for us to access different ways of working to support our populations to stay healthy and well, manage long-term conditions, and also support access to healthcare when people want it and need it. And so in all those instances that you've described, people are recognising some of the challenges and then some of the opportunities. And then the big challenge is, well, if I'm going to deploy digital health technologies, which technologies am I going to deploy and how do I deploy them? And that's really where ORCHA come in. We're the enabling infrastructure that allows you to know which technologies to pick for which communities, and then know how to distribute and activate communities to use the safest technologies to get the most benefit from them. And you're right, I was honoured to be invited to attend Parliament and give evidence at the Health Select Committee, which was really around, is the NHS able to adopt digital in a quick way? And of course, all healthcare systems are highly complex. And I think that just simplifying some of the infrastructure that's required was really what I was asked to attend to discuss. But also, I was asked questions around how do you manage future risk? And it's a really important question because, of course, digital technologies will keep changing. So even after you've embedded a technology and you've recommended it to a patient, you do need an ongoing system that allows for ongoing checks and governance and a recall should it be required, in exactly the same way we have with drugs. And again, that's what our systems do.
So speaking of drugs, you obviously work with the health life sciences sector. Can you tell me something about that?
Yeah, of course. So what we've seen with the life science sector is that they're really wanting to embrace digital health. Digital health is our new medicine, and there's a number of ways in which digital health can really be used to support people and patients. So, of course, if people are prescribed a drug, we know that adherence and optimization isn't always there, but by providing access to a digital intervention to educate that person on how to take their drug and when to take their drug and remind them to take that drug, we can start to see more benefits from drugs being prescribed. But what we're also seeing is that there's an opportunity to use digital health when drugs maybe aren't available. And a really good example of that is children and young people who are experiencing mental health needs. Of course, many drugs are not licensed for young people who maybe have anxiety or depression. And of course, what we're also seeing is, particularly in this country, is a push to say to doctors, please don't prescribe as many antidepressants. So what do? Well, there's actually 21,000 digital health technologies available in mental health. Of course, not all of them are trustworthy. And as a prescriber, you don't just want to know, is it safe? But I want to know, is it fit for this person sat in front of me? So will it work for a teenager? Will it work for a child? But that's a perfect example where a digital health intervention can support somebody when we don't necessarily have access to drugs. And then the final area is, how can we provide digital health alongside drugs? So I'm going to use myself as an example. So I live with type 1 diabetes. So I have to give myself insulin. But of course, in knowing how much insulin to give myself, I use technology and data to inform me on how much drug to provide. And that's how I manage my long-term condition on a day-to-day basis. So I think that there's so many use cases. And for me, the first opportunity is closing the gap in that opportunity. So every day, 5 million people will download a health app, but only 20% are safe. So pharmaceutical companies and the healthcare systems at large want to embrace the great technologies so that we can at least close the opportunity gap that's available.
I had no idea about the statistics. That's amazing. 5 million people a day.
Every single day. Yeah.
That's incredible. So tell me, if I'm a developer, an app developer. I'm sitting in Twickenham in London, and I think I've got something that's rather interesting. I've given it to a few of my doctor mates or a few of my nursing mates. They said, "Yeah, this has legs," and and I try to sell it, and I'm having a bit of trouble. Can you give me a user case where
absolutely. Yes, of course. So the biggest barrier to adoption is trust. People, healthcare systems, professionals don't know which technologies to trust. And so they don't know which technologies to engage with. And we're really fortunate in the NHS. We have something called the DTAC criteria. And the DTAC is a set of digital health assessment criteria by which, if you can meet it, you can be trusted. And so that's it's not formally mandated, but it is absolutely part of that procurement or commissioning process and framework. And what we do at ORCHA is we will assess and evaluate technologies to check whether they meet that criteria. And if they don't, we'll advise you on where your gaps are and what you need to do to meet that criteria. And that's really the first step in the process. This is the equivalent of getting licensed if you were a drug. So you get evaluated, tested, and then you get that badge, which is about DTAC compliance. But that's only the first step on the journey. Because then, of course, what you have to do is go out and prove that you can have an impact. And the bit of that we support is then putting these safe technologies into education so that healthcare professionals know which technologies are safe and effective, and then providing local formularies that a healthcare professional can pick and prescribe from. And so that's how we're supporting. What we want to do is be able to cut through the noise and help healthcare systems find and activate people and patients to use the best technologies.
I don't think many people watching this would realise the international impact your organisation has had. I know that you've given a lot of lectures around the world. I mean, you were in Spain not that long ago. You've been through America. ORCHA obviously has an international influence or an international arm. Can you tell me about your activities internationally?
Yeah, absolutely. So we did start our work in the NHS, mainly because that's where I was from. And my co-founder had also been a chief exec in the NHS, had a very different background, legal background. But you know, we came together and said, we want to see if we can sort this for the NHS in the first instance. But what we rapidly saw was that the problems were the same internationally. And when we founded ORCHA, you know, our mission is to improve lives through digital health. And that isn't just the lives of people living in the UK. The problems that we see around barriers to the adoption are the same, irrelevant of what country you're in. So we first of all started to do work in Europe. In the Netherlands, you touched on the GGZ, which is very much around mental health. And then we started to do more work across Europe. And then very rapidly, we started to receive incoming inquiries from further afield. So New Zealand, Australia, North America, Canada, the Middle East. And we thought, well, we need to, you know, our big mission is we want to help people. You know, as I said, what got me up at 15 gets me up today. So the more people we can help, the better we are at achieving our mission. And so that's been really the driver for this work. And the way in which we do that is we try and support people with economies of scale. So when we evaluate a technology, we passport compliance data from one country to another. So, of course, there are differences in that compliance requirement, but a lot of the questions and requirements actually are the same. So we passport the bit that's the same, which means everybody doesn't have to start at the beginning, and we can just build on top of that and then provide the distribution and activation infrastructure. And you know, my passion means that I want ORCHA to be in every country on the planet. I can't see why that can't happen, and that will really help me to achieve my ultimate mission, which is to help more people, which is what drives me forward.
Wonderful. I was going to ask about the work you've done in the USA. Is there anything in specific? Would you?
Yeah, of course. So, I mean, we work with different partners in America. So we work with a lot of the American associations. So, of course, America is very different from a structure perspective, and federally or nationally, there isn't the equivalent of, say, an NHS. So what they have are American associations. So you may have heard of organizations like the American Telemedicine Association or the American Medical Association or the American Association for Physical Therapists. And what they're doing is they're really trying to coordinate learning, development, and improvements for specific domain areas. So American Heart Association, very much around cardiology. So in working with them, you're able to influence and support more healthcare professionals with a specific domain area in mind at that federal level. But of course, we also work with healthcare providers as well. So as a healthcare provider, of course, some of the challenges are different to say that in the UK or across Europe, but providers want to provide access to healthcare. They want to make sure that outcomes are maintained. And what better way than supporting people with digital health? You know, there are more smartphones on the planet than there are toilets or toothbrushes. And so we've all bought the infrastructure. So everybody wants to embrace this, but we always come back to the question of what can we trust and how do we deploy it?
Okay, so I think that when I'm talking about ORCHA, I'm also talking about the fact that you also offer an intelligence service.
Absolutely.
And you also offer along with your assessment service. So I think that that's you offer a number of different services to people, like the young man or woman who's sitting in Twickenham in London trying to develop their app. I think that that's
Absolutely.
something. I think that's extremely.
And it's really important because one of the things that we see, because we do a global data scrape every day on the data available in the world of digital health, and what we know is that some great technologies drop off the market. So yes, we see more and more technologies enter the market, but we lose great technologies, and that's because they've not been able to rise above the noise. And what that means is if they're not able to sustain as organisations, then of course they're not able to provide employment for people. And you might think, well, why do I care? Well, I care because research tells us that wealthier populations are healthier. So if you can get more people into work, you can actually support people's health through them being employed. And I really see that digital health has got a role to play in that. If we can support small companies to grow and employ more people, then we're going to have a wealthier population who have jobs, but we need to help them to become sustainable. And I suppose that's why I'm passionate about my role as Vice Chair at Tech UK, and that's all about supporting industry to have a place at the table. And of course, they've got the technology and the solutions that can benefit patients, but they also have a role to play in driving forward a healthy economy. And of course, economic challenges are something that every country in the world is faced with.
Absolutely. So how big is ORCHA right now in terms of personnel numbers?
So we currently have around about 125 people that we employ, and I'm really proud of that, because I see people, they work with us and they're now buying houses, they're having families. I never thought about that when we founded ORCHA, but it does give me quite a lot of pride. But we also have 3 different organisations. So we're headquartered in the UK, but we also have a European headquarter and an American one as well. And so it's as we've grown, of course, the structures, and I've had to do a lot of learning in this area, have become more and more complex. I've still got a lot of learning to do, but it's really important. And the reason it's important is for a few points. That economic area that I mentioned is really important. If you're going to be working for us, we're going to be working in North America. We want to employ North American people who understand the infrastructure, but of course we want to support their economy to thrive as well. So it's got to be, I'm obsessed with having a win-win for everybody. So we're building out the American team at the moment, and I can see that this will be replicated as we grow into other countries.
I understand you've also developed a very good relationship with Australia.
Yes. So in fact, I was just on a call this morning with a wonderful partner, the American Institute for Digital, the Australasian, Institute for Digital Health. So I was talking to their chief exec, a lady called Louise, this morning, and it's early stages, but what we're doing is we're partnering with them to really set the scene for what is possible. And of course, what we've seen over the last 8 to 10 years is that there's real learning that every country can look to and then leapfrog over some of the challenges that some countries have experienced by maybe going into rabbit holes or having to do some painful learning. And that's what I'm really keen to do, because I want to get to a position, as I said, globally, where we can help people. And of course, getting stuck on some of the problem areas, like how do you assess technologies? What is the standard for assessing technologies? It's interesting, but I am desperate to get into the distribution and helping people side of the equation. And so those are some of the conversations that we're having in Australia.
Oh, fabulous. I know that the Australians are looking at a reimbursable pathways for apps in different states, because it is a federation of states. And I think that with the models that are currently in play in Europe, we can learn a lot from the good and the bad.
Yes. And I think that's what I'm really keen to do, to help to accelerate the process and invest any capital and money into getting these technologies into the hands of people who need it right now.
I was in a conversation the other day with the head of the Catalonian autonomous region, the health medical director, and we were discussing a client, a pharmaceutical company, and he made the comment that we don't need more doctors or nurses, we need better digital technology because it will help us get around many of the issues that we've got. And he's actually being instrumental in getting 3 particular digital technologies that are working with pharma reimbursed. I think that particular comment about we need better digital apps, we need better technology, not more doctors and nurses, is really down your street.
Yeah, I mean, I don't think a digital health technology will ever replace a doctor or a nurse. But I think, and I just want to share an example, because people quite often think, well, how can digital health help? And I'm going to give a really basic example. So hip and knee operations. In this country, there are 7.2 million people waiting for a hip or knee operation. Over 500,000 have waited more than 2 years. Now, so you think, well, how can digital health help with that problem? Well, for those people who are waiting, they're waiting in pain. They're probably not sleeping. It's probably affecting their mood. They're not mobile, so they may be putting on weight. They might be eating the wrong foods. They may be drinking, smoking. And what that means is when they get to the operation, they might not be in a good position to have that operation. So what we know in the UK is that 20% of operations are cancelled because patients aren't ready for that operation. So that's where digital can help. Let's help people who are living in pain, struggling to sleep, stressed, not mobile, not eating the right diet. Digital technologies can help right now. And what impact does that have on the healthcare system? Well, you reduce the revolving door into primary care and GP practices, because those people will keep coming back in saying, I'm in pain, I'm struggling to sleep. So let's give them something that supports that root cause. Of course, once they get into the operating theatre, they need a surgeon. A digital technology can't do that bit. But then what we also know is that post surgery, they need rehabilitation. And waiting in a hospital, having access to, say, physiotherapy and occupational therapy in a hospital bed means that you then can't process the next person who may need access to that bed. So why not provide them with a digital health package so they can get home quicker with something safe and effective that can rehabilitate them faster? And of course, what it means is that for anybody who doesn't want digital health, and digital health isn't for everybody, they can have access to the physiotherapist. But for somebody like me who travels a lot, I don't have the time to go into hospital and stay in hospital, and I don't want to be doing that. I'd rather have a digital health intervention. But the question is, which technologies will be most effective for me at that point? So I just wanted to share that as a simple example. And we did do some health economic modelling on this. And we showed that 4 pathways in this country would release over 500 million GP appointments immediately.
Was that done with Warwick?
It was done with Warwick, yes. Yes.
Read it. It was a nice piece of work.
Yeah. So that was something that I took to the Health Select Committee, which is about the opportunity. And so, unfortunately, digital is the answer in a lot of cases at the moment, while we train up potentially more nurses and doctors. But of course, what we're seeing is our populations are aging with more complex health needs, and we're living longer, which is a real gift. Again, to use myself as an example, I wouldn't be here if I was born 100 years ago. So I have to say I'm so grateful, but I then could be putting a pressure on the healthcare system.
Absolutely. Okay. Look, an absolute joy to talk to you and see you again. And I wanted to wish you all the very best.